We have arms going on right now with an influencer in Scottsdale. Her name is Kira, and should we go to Scottsdale now? Mm-hmm. Okay. Well, Kira, so everyone knows you from Dance Moms. Is that what I hear?
Yes.
That's awesome. I've watched that show before. I would love to look. So Dr. Pierce did one of your arms with AirSculpt. Let's take a look at the difference. Dr. Pierce, will you show us the arm you did versus the arm that hasn't been done?
Sure. This is the arm that's completed.
Okay, let's get that camera positioned on her arm. So point it down more and move a little further away.
So this way. There you go.
There we go. Okay. So
this has been done.
Can you show us the insertion site on her elbow, please? Let's
This
take
little
a look.
tiny one right here.
Okay. Thank you. Great. And let's look at her left arm versus her right arm. So everyone, what we're doing is a side-by-side comparison showing her left arm versus her right arm. Her left arm is, and the reason I'm showing you that is she actually has an instant result. You'll be able to see a big difference already between her left and right arm. So let's just look from far away enough. Whoever's holding the camera. Okay. So that's her right arm, and let's compare it to her left arm. Show both, please. There we go. And stretch her arms out. So straighten her elbows, and let's take a look. So put them up by her head. Great. Okay, so you can see there's a big difference. So I want to hear about your experience so far. So you had one arm done. How did that feel?
No pain at all. There's literally, I've been talking to them the whole time.
I love that. And have you seen the difference between your left and right arm yet?
Yes. Huge.
Is that cool?
Yes.
What was it like to see the fat come out of your arm? I bet that was pretty weird, huh?
It's crazy to see the whole process go down. I mean, there's no pain, you're awake, and your fat's getting dissolved.
Yeah.
Basically.
I love that. And tell me about your arms. How long have they been a problem for you?
I've been dieting and working out for a year, and I mean, I just can't get rid of them. They've always been there all my life, but there was no way it's just a stubborn fat area. It wasn't going away.
I've had patients that are supermodels, actresses, fit models. Like I had an Olympian who had her arms done. She was actually in the Olympics and could not lose her arm fat. She said since puberty she had arm fat. She was otherwise completely ripped. Her body fat was so low, and her friends thought she was crazy, but her arms really bothered her because they didn't make sense with the rest of her body. And literally in half an hour, we made her arms exactly what she wanted them to be. So your arms are going to be magical. And without further ado, Dr. Pierce, you want to start doing her right arm while you can AirSculpt her right arm while we keep asking her questions.
Okay.
Great. So we're going to start your right arm. And what's it like for you to be awake, Kira?
I love it because I can ask all the questions I want.
You sure can. Do you have any questions for me?
Not too much. I mean, this is the best thing ever because you're awake, you can talk, listen to music, and we go.
What music have you been listening to? It's really the most important question I ask.
Kind of a mixture of everything. It's not like I love Justin Bieber, but we've been listening to a mixture.
Okay, but heavy on the Biebs?
Heavy on the Biebs.
Yes. Yes.
Okay. And do you have any arm inspiration? Is there anyone's arms you are hoping to get?
Any what?
Any armspiration? Anyone's arms you are hoping to get?
No, not really. Just get rid of the flabby arms. That's it.
I got you.
Tone them up. Make them look good.
What would you tell people who are watching or friends and family that are interested in getting AirSculpt?
Oh my gosh, I heard someone tell me once that they're so scared.
Really?
And this is nothing. I mean, he's doing it right now, and I'm talking to you.
Let's show Dr. Pierce doing her arm. So I think your message is don't be scared, huh?
Don't be scared.
I like that. And
It's the easiest thing ever.
were you scared?
No.
Well, I'm
I'm
glad
not.
you're scared. I mean, you look like you're having a blast there.
It is amazing.
Did you gain weight over quarantine?
Oh my gosh. Yes. I think I gained more over the holidays.
Oh, yeah?
So this has been
If
amazing.
you combine quarantine with the holidays, it's a lot of weight gain.
Yes.
Yeah. Well, I'm so glad that you came and that you agreed to share your experience with us. It's an honor to do this with you. We really appreciate it.
I love that you have come up with something that's so easy.
Thank
And the
you.
recovery time's nothing.
Your recovery time is going to be nothing. Tomorrow, I'm telling you right now in front of everybody watching, you can do whatever you want. Literally, whatever you want. You're going to see you have an instant result like you do on your left arm. You'll have it on your right arm. And we're going to show your arm before and after next week. And
Yes.
2 months from now, your arms will be what you always dreamed of, literally. Like, you know, you won't have your full result in 1 week or 2 weeks, but probably around 2 months you will. Arms heal
And
very
I'm so ready for the summer.
They will definitely be ready for the summer. I think you'll be wearing sleeveless. Were you not wearing sleeveless?
You know, I just hated it. Because it was, I mean, the shaky, the flabby, just wasn't the cool look.
Yeah. Well, I want you wearing tank tops all summer.
I will.
That's what I call success.
Yes.
Well, thank you very much for sharing your experience with us. Thank you, Dr. Pierce in the Scottsdale office.
Hi.
So I hear you love your arms.
Oh my gosh, I am so obsessed. I've had so much just confidence brought out by the arms.
I'm so happy to hear that. We're going to show your pictures behind me for a second. But then, I don't know what you're wearing, but maybe you can show your arm. Yeah, oh, whoa. Those are serious results there, young lady.
I'm wearing I don't know if you'll be able to see. Let's see, because I should have wore a better shirt, but I mean,
That is beautiful. I mean, first of all.
The best thing is
Pardon me?
it's hard. Like there's no, it's hard. Like it's my entire arm feels like muscle.
That's how it should be. And tell us, how did the skin do? It looks to me like your skin really shrunk up.
It did. It's funny because I work out a lot, like 5 to 6 days a week, and I have done that for a very long time, and my arms just would never develop. And I was kind of concerned because I was like, well, what's the skin going to do? It just tightened up right in with the muscle.
Yeah. That's one of the most important and special things about AirSculpt. That's what makes this technology so transformative. Is not only does it take out the unwanted fat while you're away, you can do whatever you want the next day, et cetera, but we really shrink the skin. It's not just, a little bit of skin shrinkage, but no, I mean, this is a huge amount of skin shrinkage. So
Yes.
this is everything I could have hoped for from your procedure. And more than anything, I love seeing that smile on your face. So
It was so much more because I was like, I just didn't know how much we'd actually been able to take out and get the look I was going for. And this, I mean, it was much more than I thought.
that's wonderful. I'm so happy to hear that. A couple questions that we ask everybody is, how did you find out about AirSculpt?
I had some friends use you guys when you first opened in Beverly Hills, and 2 of them, and they did pretty much their entire body. And when I saw them, I was like, oh my gosh. And then they told me the process. So I had been following and looking into it for a really long time, but nervous as most people. And then I was just to a point where I'm like, I'm doing it. I'm diving head first and I'm doing it.
And what was the experience like? I know we did you on camera, but what was it like getting it done? And then what was it like? What was your recovery like?
It was so easy. I mean, from all the way from going in to the consult to the day the procedure was done, everything went so smooth. And I mean, it was so easy. And then the recovery was nothing. I was up doing dishes, laundry. I was back to mom life the next morning.
That's what we tell everyone. And that's why we do this show, is because it's one thing for us to write it on the website or Instagram. It's another thing to hear it from an actual patient. And that's so important to us and so important to our prospective patients that probably have been following us for years and are like, is this real? How are these results so good? I mean, look at the back of your arms. I see a beautiful triceps definition. I see no saggy skin at all. And I see a beautiful arm. Like, I assume you're ready to wear tank tops this summer in Scottsdale.
Oh, we've been there. It's 95 degrees. We've been there. And you know what's so crazy to me too is like the incision point where they went in. The one on my elbow is gone. You can't, I mean, can't even see it.
I see. Oh, I see a little red dot. Yeah.
But that's it. That is it. I mean, and with time, that heals. That's
it's only been 3
heal.
months. In 6 months, that will be gone.
Yeah.
So a lot of people do worry about scars, and I'll show them just like I do all the time. It's only this big. We're talking about the size of a freckle, the hole. And so for 3 months, what you have is perfect. And in 6 months, I expect it'll be completely gone. So no one needs to know, unless you want to tell them.
Yeah, everything about it was so easy. You're awake the entire time. I was like on the phone. I was calling my husband and I was like, look, this is what it is.
Yeah.
And it was so simple.
I'm so happy to hear that. That's what this is all about, is we're able to shrink your skin, take your unwanted fat, do it in, an hour and a half, have you back into your normal life the next day and have amazing results, and that's what's so important about what we're doing here. So if someone were to ask you, hey, I was thinking about getting some body contouring done, what do you think about AirSculpt? What would you tell people that are interested in getting rid of some unwanted fat?
Oh my gosh. So after my 1 week post, I was sending everybody pictures and I'm like, you have to check this place out. This is amazing. Cause I have a lot of friends that want to do the mommy makeover. They're done with kids. And actually I think two of my friends have already gone in. One was a couple weeks ago, did it. And she's so happy with her results. So I tell everybody, because it is so worth it. The amount, and like, it's so worth it for your confidence. We all have those problem areas that just, you can't get rid of. Dieting, exercising, no matter what you do, it's just genetics.
Yeah.
And we have to face the reality of that. Or, childbearing. I have 3 kids. It's like, your body doesn't go back to normal. No matter how much you want to say it doesn't.
No.
And something so simple like AirSculpt, I mean, it was the recovery time, everything about it, I would recommend to everyone.
I'm so happy to hear that. What I like to tell my patients is you can't spot treat the body. People think, oh, I don't like my arms, so I'm going to do a lot of arm exercises. A lot of times that makes women's arms actually bigger because it just builds up muscle. You can't spot treat fat, except with AirSculpt, right? So anytime someone has an unwanted pocket of fat that's diet and exercise resistant, I think this is the absolute best answer out there. And I'm so happy that you did this. You had such a great experience. And it's just an honor that you're willing to share this with everyone, not only once, but twice. So thank you so much, really, from all of us. It's been an absolute pleasure. And I can't thank you enough. I'm so happy you're happy.
And thank you, because this is amazing, and what you're doing for people is amazing, because a lot of people don't want to go under. They don't
No.
want the long, recovery times. We live in a fast going, let's do this and be done.
No one needs to go under. I can't imagine putting someone under for body contouring. We can take out the exact same amount of fat, if not more, and actually you can be a part of your procedure. You can see what's going on. You can interact with your doctor. There's no mysteries. It's scary to be put under, and it's also dangerous. There's no reason to do that, especially when you're going to get a higher quality result with AirSculpt. Like, it just makes no sense. And that's why we do these videos so much, is to try to help people understand that. So,
Yes.
Kira, you've been absolutely wonderful. I can't thank you enough. And I really am so glad you had such a good experience.
Thank you.
Well, okay. We're going to answer some questions about arms now. Wait, any questions for Kira about arms? Let's see if we have any questions. And then you can answer them directly. Let's see.
Okay.
I don't know. Okay, it looks like we have no. Oh, there might be one. Let's see if we have any questions.
Does it help with skin tightening?
Oh, does it help with skin tightening? So, how do you feel about your skin? We talked about it a little bit, but were you
I was
surprised?
worried about that, but it was tight. It's tight. It's hard. It's like a muscle, one big muscle.
That's wonderful to hear. Yeah, I think that's probably our patient's biggest concern before they get AirSculpt. What I hear every day and see on Instagram every day and blah, blah, blah is, what's going to happen to my skin? I say it's always going to be tighter. It may or may not be tight depending on what you're starting with, but it's always going to be tighter. And as you can see right here, it clearly is. So any others, Lauren?
Yeah, someone's asking how you felt about being awake during the procedure.
Well, I loved it because I love knowing what's going on. So being able to see the process, I was like, oh my gosh, this is amazing. And I was calling my daughter. I was calling everybody and showing them, because I just couldn't believe that this is happening and I'm awake.
I hear that all the time. It's really nice. First of all, you can call your loved ones, friends. You can get support from them. You're allowed to bring people even into the procedure room if you need a little hand holding or if you're scared. And we encourage that. We want this to be the most fun, the most rewarding experience you've ever had in the doctor's office. That's always our goal. And everyone always goes in and they're a little nervous. I mean, it's normal, right? Even if before you go to the dentist, when I go to the dentist, I'm a little nervous before I get in the chair. So it's just normal. So it's normal to be nervous, everybody. And as you can see, it's just nothing to be worried about. Once you get on the table, everyone's like, "This is it. It doesn't hurt at all." I was I was expecting it to, pinch. I was expecting this and that. How much did it hurt?
That's the funny thing too. So I was like, oh, when I get home, because you get home and all I did was sleep pretty much. And then the next morning I was like, oh, how is this going to feel? It was nothing. I took off the garments and switched the bandages and put it back on. It was nothing. There was mild bruising, and I think I had shown that on my stories. But I mean, your pain is your bruise. There's no pain in like actual, oh my gosh, I can't move my arms up. Like I said, I was washing dishes and doing laundry. So that's very arms moving.
Yes, it is.
And no pain.
We're so happy to hear that. Thanks so much again, Kara. It's been an honor and a pleasure, and I hope to hear from you soon. We're sending you an AirSculpt sweatshirt because I heard you didn't get one.
Oh, I didn't. And you know what? I wear those t-shirts all the time. They're so comfortable.
Amazing. That's great. Thank you so much. We're going to answer some other questions about arms, and we just really appreciate your willingness to share your experience with everybody.
Thank you.
Okay, Lauren, let's go to our arm questions.
I saw.
I don't know.
I see a lot of questions about asking about lymphatic massage.
Oh, okay. Let me answer that while you're on the phone. AirSculpt does not require lymphatic massage at all. it's old school stuff for old school procedures. You can do it if you want, but I don't recommend it. It's not necessary. It's not going to change your final result. Did you do them?
I did not.
Yeah,
No.
there's no reason to do them. And I think in my whole career, I may have advised 3 people to do them because they were getting married like 3 days later, and maybe it would help with a little bit of the swelling. But AirSculpt does not require lymphatic drainage massages. It doesn't require second stage garments. It doesn't require wearing your garment for any more than 2 weeks, unless sometimes with fat transfers we do 3 weeks, but in general it's just 2 weeks, and that's it. That's what's so special about AirSculpt. So thanks for bringing that up, because it's something that's very near and dear to me. Lymphatic drainage massages, no one wants to do that. This is a come into a really nice spa, get skinnier, go home, move on with your life procedure. It's not like, find a lymphatic drainage massage person, go in every week. That's not what we're doing here. So, and look at our results. So thank you, Kira. I appreciate it. I'm glad we couldn't transfer over. That's a perfect question.
I had a lot of people actually ask me that too, that I had told about, and I hadn't even heard of it, so I didn't really know what they were talking about. And I'm like, I didn't do anything. I just wore garments for 2 weeks and I was done.
That's the way it is. Thank you. That's exactly what I want to transmit here. Is that's all old school stuff for the older procedures that we don't do. So thank you very much.